So glad you could join. We're so glad you could join us for Exploring Careers in Nursing Education. Whether you are a bedside nurse, considering a new chapter, or simply curious about stepping maybe into a teaching role, you're definitely in the right place for the next hour. My name is Rebecca Badeau, and I will be your host today. I'm also the Director for Strategic Communications at the Betty Irene Moore School of Nursing at UC Davis. And this webinar really is designed to really feature two exciting programs. We have our clinical instructor internship and our nurse faculty residency. They are both offered under what we call Retain. These programs were really to support nurses like you in exploring a transition into academic or clinical teaching roles. To bring this to life, we will hear from a panel of current nurse faculty and clinical instructors who will really share their personal journeys, offer some practical insights, and answer the questions that we hope you populate in the Q&A throughout the webinar, really about entering the field. So here's what to expect from today's session, where we'll give you a brief overview of Retain and both the clinical instructor internship and the nurse faculty residency program. A panel discussion with experienced nurse faculty and clinical instructors. The live audience Q&A, that's your role. We want to hear from you. And then, of course, we will give you information on the application process so that you can fulfill your desire to grow in these areas. If at any time you have a question, please use that Q&A feature. That's what we are monitoring. We'll take as many questions as we can, and then we will follow up via email. Fortunately, we have the Retain program staff who are well-versed in everything about the two facets of this program. They may be answering some of the more individual questions on a one-on-one basis, but they're a great resource and support, and they are in the background, so to speak, for the next hour. Also wanted to let you know that we are recording this, and it will be on our webpage. In case you missed something, you'll be able to go back and watch it. We'll get it on our webpage in the next day or so. So let's begin with a brief overview of Retain. So here's how we came up with the acronym. Retain stands for Residency in Education, Teaching, and Instruction in Nursing program. It is funded by the U.S. Department of Labor grant, and it really aims to expand the pipeline of highly qualified nursing instructors and educators while also increasing capacity for new student nurse admissions. We hear about that shortage all the time, right? Well, shortage of nurses is because we have a shortage of faculty and instructors who train all of those folks who want to become nurses. So this is really part of the solution that the Betty Irene Moore School of Nursing wanted to be a part of. Retain is supported by a $6 million award over a 5-year period, which really concludes in June of 2028. Our goal of producing nurse faculty graduates and clinical instructor internship graduates will be achieved with the support of key partners at schools of nursing and nursing organizations in our region. It really does take a village, and this program is a testament to that. These brand new programs were developed in response to the growing need for nurse educators, and they're designed to make the transition into nursing education approachable, well supported, and successful, because ultimately that's what we hope. So this slide highlights the key objectives of the Retain programs. At the top, you'll see our primary goal is to create that pipeline and educational pathway for registered nurses who are interested in becoming educators. From that goal, we've developed two distinct yet complementary programs. The Nurse Faculty Residency, which is designed to educate and train RNs to become academic faculty. Then the Clinical Instructor Internship, which focuses on preparing RNs to serve as clinical instructors for that hands-on care settings. Ultimately, both programs work toward a shared outcome: increasing the number of skilled RN faculty and clinical instructors in California's nursing schools and programs. So you can see kind of here how they break down side by side. First, let's look at the nurse faculty residency there on the left-hand side. It really focuses on preparing nurses for that academic faculty role. You may be stepping into a full or part-time teaching position. This program will provide that structured guidance on how do you design curriculum? How do you engage students? How do you manage the classroom? And really, how do you navigate this academic setting? These are skills that likely you didn't learn when you were learning to become an RN. This is that missing piece to help you move into that educator role. It's a 12-month time commitment where participants spend about half their time completing learning opportunities and precepted experiential classroom teaching, and the other half of their time is left to completing a master's degree if they are currently a student or working in a part-time position. We do offer up to $50,000 in tuition reimbursement for participants enrolled in master's degree programs during their residency. Additionally, residents will receive a $75,000 stipend for their participation, which is paid out monthly as long as the program requirements are met. So now let's look at the clinical instructor internship, right-hand side. This program is really designed for nurses interested in teaching in the clinical setting, so outside of the classroom, but actually in the clinical setting, especially those who might be a little newer to instructional roles. It offers mentorship, skills training, and hands-on support to help participants really build the confidence and the competence in guiding students in those real-world clinical environments. This is a more intensive, but it's a shorter 14-week program where interns spend approximately 50% of their time completing learning activities and 50% of time in precepted clinical teaching. You'll complete at least 90 hours with an experienced clinical instructor preceptor by the end of the program. Compensation for interns is approximately $14,000 and it's split into 2 payments. Finally, both tracks offer need-based supportive funds to participants who need further financial support, such as travel or even childcare. Supportive funds will vary based on need, which will be assessed and documented by the wonderful retained staff I mentioned earlier and at the start of your program. So let's review a few key eligibility requirements for Retain related to your employment status. First, full-time employment at 1 FTE or 0.9 FTE for RNs working 12-hour shifts is not allowed during this traineeship. That will be different than what you're used to, but just take a look. It is not allowed if you are going to benefit from these programs. Additionally, we're currently unable to accept UC Davis employees into the programs, but believe me, since we are on the campus of UC Davis, we are actively working with the Department of Labor to hopefully remove this requirement for future cohorts. So stay tuned if you tuned in and you are a UC Davis employee. Also, participants cannot be current or former faculty member in a school of nursing, with the caveat that prior employment as a clinical instructor is permitted for the nurse faculty resident track only, not for the clinical instructor internship. And if you are unemployed or underemployed as a part-time or per diem worker, you are eligible to apply. Incumbent workers are also eligible, which just means that their employer has an agreement with UC Davis's School of Nursing to upskill them into a faculty or clinical instructor position. So I know it's a lot, but if you scan these QR codes or if you visit our website, you can learn more on this comprehensive eligibility information. And while you do that, a few other key requirements to make note of are that, of course, you must have a valid, current, and active RN license through the California Board of Registered Nursing. You must also possess a baccalaureate degree and have at least 1 year of continuous full-time experience as an RN within the last 5 years. And finally, you must be available to fully participate in all learning activities during the program timeframe. So what does this all mean when we break it down? We are thrilled to hear from this wonderful panel of experienced nurse faculty and clinical instructors. As preceptors and core faculty for our retained participants, they bring valuable perspectives and really that lived experience from making the very transitions we're discussing today. I am going to ask each of our panelists to introduce themselves, and let's look at the screen and let's go from left to right. So Sandra, you're up first.
Hello, everyone. Thank you so much for having me today. So my name is Sandra Kamba. I'm a nurse practitioner, but I'm a nurse faculty health science assistant professor at the School of Nursing. And currently my places where I'm doing my clinical practice is at the Healthy Aging Clinic with UC Davis, as well as the mobile nurse-led mobile clinic with UC Davis. Thank you.
Vandy, jump right in.
Perfect. Thank you. Thank you, Rebecca. Hello, everyone. My name is Vandy. I am currently a practicing psychiatric mental health nurse practitioner out in the Bay Area. We are actually a part of a UC collaborative for our PMHNP certificate program. So part-time, I'm working with the UC Davis as a lead faculty educator, and then the other portion of my time is with UCSF as an assistant adjunct professor. Thank you. I'll pass it to Cherise.
Cherise.
Hi, everyone. Thank you for having me. My name is Cherise Ong. I am an assistant program director for MEPN, as well as an assistant clinical professor. My background mainly is with actually UC Davis Health for about 10 years. So I am very experienced and know the transition between clinical to faculty / clinical instructor too. So thank you for having me.
All right, Cindy, bring it
Good
home
afternoon,
to us.
everybody. My name is Cindy Wilson, and I work for the Retain team as a clinical nurse educator, mostly coordinating the activities for the clinical instructor interns. And I have worked as a public health nurse for most of the last bit of my career, and I have been a clinical instructor in the community health class at UC Davis for the last several years.
Thank you, Cindy, and thank you, everyone. Clearly, this is a seasoned group of people, and I really want this Q&A session just among ourselves before we bring in some of the questions that our participants have today. I really want it free-flowing. So if we jump in and talk over each other, that's okay. We'll eventually figure it out. So I'm going to throw a question out to all of you. We'll get some more specifics to each of the different roles, but what inspired you to pursue your current career, either as a clinical instructor or nurse faculty? Who wants to take the first one?
I can start. So I think that mentoring people and being an educational leader has always been part of who I am, both in my personal life and in my professional life. When I worked in public health, I was the director of nursing for the Nevada County Public Health Department, and I was a preceptor for a lot of students who came through our department doing their community health rotations from various schools. And it was one of the things that, as the nursing director, I felt was really critical to our department for our public health nurses to have that input into nursing students. Public health is a less known aspect of nursing. And so there is some research that documents that one of the best ways to draw nurses into public health is to give them a good clinical experience when they're in school. So it became a passion of mine in that job. And then when I transitioned to UC Davis, the opportunity came up to go back to Nevada County Public Health as a clinical instructor. So working with my former colleagues there, the person who took my place in my job. And so kind of a full circle thing to have various roles in the education of students, and in particular in their community health sessions.
Vandy, I see you nodding a lot. I'm going to ask you, does the word passion resonate with you?
Of course, I think similar to Cindy, I started off with precepting at first as well, and it's just so nice to have that one-on-one time with students and that connection. It was essentially like a foot in the door before really thinking about taking on a role with academia. It was never on my like 5-year plan track, and so it was actually I think some of the biggest inspiration were instructors that felt that gave a lot of support and that saw a lot of potential within me, and I just never experienced that before, and I wanted to be able to give that um, to the students that we do work with. And I think you got a little bit of it in precepting, and then you kind of walk into this whole other big world afterwards. But yeah, I would say my biggest inspiration are like really good nursing instructors prior to joining academia.
Who next? Sandra, I see nodding and a big smile. So something Vandy's saying is resonating with you as well.
Of course, I think for me, my path has been a little bit different because I was an educator first before I became a nurse. So I taught math, geometry for so many years before I changed career into nursing. And it just felt like I was home being a nurse and with that teaching background. And when I had an opportunity to actually marry those two passions together, it just seemed like a very reasonable path for me to take. And I think on top of that, what also inspired me is that I don't see a lot of people who look like me in these positions as educators. And I think there's something to be said about having diversity in lived experiences with our educators that can just give breadth to our curriculum as educators. So I'm inspired and I'm passionate as well to work with learners. And mhm.
So, Sharice, I have to bring in, since you have such a UC Davis history and now with the School of Nursing as well, this diversity of perspective piece. How important do you think it is in these roles as nurse faculty or as clinical instructors so that we can care for the populations that we, are mirror and care for them and have some sort of a cultural connection or understanding?
I think that's really key, since I'm an immigrant and I was born in a different country. My first dialect was not English, so I definitely struggled through my education. And a lot of what led me to go into nursing education was my prior experience in primary and secondary schooling, right? So I often had struggles, and even becoming a nurse, I didn't have the greatest experience because of the educators I had. So I kind of have a completely different experience from the other ladies in this panel. And so that's what led me to understand that, hey, we have a very broken system. And a part of the broken system is that we it starts off with education. And it's harder for when there's a lack of diversity for other people that we serve to understand what we're trying to educate them on. My last clinical experience was in transplant, so I worked a lot with kidney transplant patients, and that was the most diverse unit I've ever worked on. There was lots of different languages spoken, and my manager had indicated there's a reason for that. The kidney population is very diverse, and she wanted to mirror the same diversity in her staff. And we did a lot of education in that sense. So I provided a lot of nursing education to my patients, even in my primary dialect. So I think that's really key.
Okay, this is interesting because I'm seeing two opposite ends of the spectrum. Sandra, who was already in education, I'm a communicator, so what you were teaching, Sandra, really scares me. I'm just going to go out on the record. But Sharice, you weren't, we think about, oh, that teacher who motivated me, that teacher who mentored. You didn't have that experience. So I want to ping on both of those.
Mhm.
Sharice, how did you move into the point where you wanted to be that educator? Because there wasn't something that you would have mirrored or experienced.
I think the more I worked in nursing, the more I realized a lot of the issues in healthcare are related to patients not understanding anything about their pathophysiology or their chronic disease. And I just hear how people provide education to their patients, assuming that the patient just understands all these lingo and all these medical terms when you have to break it down to simpler terms. So I felt like that became a strength as this time went on. When I worked in my one of my older units, which is trauma. I got a lot of the patients that had difficult discharges that required a lot of coordination, and with coordination involves education as well. So I guess, I don't know, my mom has always said that I've kind of been natural at educating. But I did have one influential educator in my past. It was my sixth grade teacher who never stopped believing in me. So she was one of the motivating instructors, but in nursing school, it was just very different. And I would have night and day instructors, and I would see the benefit of having high expectations, but being reasonable and being supportive. And so in that sense, I ended up precepting a lot of students, working with a lot of students daily when I was on the clinical floor.
It's amazing you're now pouring into students what you wish you had had
Mhm.
outside of sixth grade, which was a long time ago. So, Sandra, how is it different teaching in the nursing profession, right? There are a lot of other components in nursing outside of math. No, I'm kidding. So, what was the transition like? Because I imagine there was still some skill building there.
No, definitely there is some skill building because you have to be competent in the subject area that you're teaching, right? But I think the biggest difference when I taught math, it was high school students. So definitely for me, it was a little bit more challenging. Being an immigrant as well, like the rules around teaching in Zimbabwe, where I come from, is definitely different than here. So there was culture shock, and high school students are not always the kindest because they're going through so many different things. So teaching adults has been so different because most of the folks really they want to be where they are. So there's not a lot of pushing and a lot of trying to convince people that yes, they should do this. And teaching math is also difficult because people have come with different ideas about what math means to them. So in that case, it's been easier to transition into teaching adults. But it also means that I have to, when you look at medicine or nursing, it's constantly growing. So I constantly have to be on top of that and self-teaching as well to make sure that you're up to date with standards. Mhm.
Yeah, math seems to be so finite, and we are in healthcare, which is it's evolving, it's innovative, it's having to change in the world of so many things. I think about AI, I think about care delivery models, I think about how we came out of COVID and telehealth and all these different things. Cindy, I want to bring you in. We can expand upon the idea of did you envision yourself in academia, but in home health, obviously there was a large teaching component with the populations that you serve, but what was the biggest adjustment kind of moving from the clinical space into kind of that educator role?
I think for me, it is the lack of contact with the patients and the community that I had been used to interacting with every single day. So less of that and more at my computer, perhaps. Um, but it also helps me to just kind of frame that in that this kind of bigger picture stuff is making a big difference to multiple patients in multiple communities. So reminding myself that I'm still working with patients and working with communities. I'm just doing it in a little bit different way. And it's less hands-on for me, but perhaps more impactful over time.
Yeah, talk about impact, Vandy. You move from patients at the bedside, and obviously lots of patients served over a career, but then you move up where you can impact countless patients in the way that you train those future nurses, right? Those new generations. What either adjustment or what did you find most rewarding about, what do you find most rewarding about that?
Yeah, I will say there is a little bit of an adjustment. I feel like nursing, sometimes it feels a little bit natural of providing patient care, and then it takes a little bit more planning and coordinating with all the other administrative teams and learning about all the different student services and different ways to adjust to the learner. So I think for me, that was one of the biggest adjustment was learning about all the different resources to support a certain few that might need to have um, have a slight adjustment in terms of how they're going through the program. But it's actually really, that's the rewarding part, is when they succeed and they end up feeling a little bit bumpy in the beginning, but then you see them getting praises and doing really well in clinicals after. I think the student success is really a lot of the reward that comes from it. For me, it's when I see even the content or the things that we teach in lecture or didactic, and it comes out in their assignments, and I feel like, oh, they listened, like they actually listened, and seeing their skills develop. I enjoy their questions if it is like really meaningful questions, because I feel like that's where the richness of education comes through. And that I think, touching on Sandra's content about adult learners, I really value being able to facilitate or have that space where we do have the adult discussions with the adult learning of a lot of the case conceptualization and the difficult topics, and things aren't straightforward from the textbook. So that's probably where the rewarding piece comes from.
So I want to kind of focus on like the nurse faculty piece, because Sandra, we talk about we want diversity of providers because we're serving a very diverse population. Where does the diverse styles in which people learn? How do you build those skills to reach everyone in the group? Because not everybody receives information the same way, and there are ways we need to identify in order to support people so they can perform at their best, even it may not be the traditional mold that maybe we're led to believe is the way people learn.
No, you're so right. I think that in the way we deliver content, we can diversify the way we do that. One time it could be group work, group assignments, or it could be have a case study to work on that they're actually learning the material through a case study. So as faculty, you have to also be on your toes in how you deliver the information, because it's going to be different for every student. And even how you grade things is also going to be different, not the same way all the time, how you assess whether learners are actually understanding the material or not. So there's got to be room to be open and really assess what's more effective for your for the learners, so you can reach them where they are.
So, Vandy, when we talk about innovation in healthcare, because that's something that the Betty Irene Moore School of Nursing really prides itself in. I mean, we're creating change agents for healthcare. We have to be able to evolve and adapt and course correct and all of that. What does it mean when you are developing lesson plans and looking at the current environment, maybe new things that are coming in? How do you plan for that? And then what is it like when you see the aha moment that your students are getting it?
Yeah, no, I think that's actually an example of us from last quarter with, I know you commented that AI is this new thing that's getting more popularity, and so we ended up shifting like mid curriculum just to adapt it into one of the assignments, to have them run through an AI generated result and then critique it and see if it's as accurate as they would accurate as it would be in comparison to what they would research and develop for the pharmacology course. So I thought that was a beautiful way of weaving things in. And I know I'm probably like losing track of the different questions that you're having, but I did hear something from Sandra that I wanted to highlight, is that you kind of are on your feet, even though like you may be teaching the same topic year after year, but it's the group and cohort dynamic that makes the topic either land well or not land well. Because I showed a video related to modifying psychotherapy to be able to meet clients where they're at. And one group really, like, it really resonated with them and they were able to reflect on it. Whereas another group, they were really struggling to understand the video. And so you kind of adjust based on what the learning objectives were for that time and see what other ways that you can still get the message across, and also use that opportunity of seeing that maybe we do need to modify and adjust or add things here and there. The beautiful part too about teaching is that it's a constant quality improvement. I think we're always revisiting the last quarter or even the whole year as like what needs to be included, what needs to shift, what needs to change. In matching with the time too, I think there's the pharmacogenetics that keeps popping up too. And so we slowly started embedding that into discussions and just trying to keep up with the news and making sure we're also mindful of that and creating space if for our class, because it impacts the clients that we are serving, and how to best address that with our clients and meeting the clients where they're at, of being able to recognize ourselves of how we're kind of processing the information that we're receiving. I think one big example is probably COVID, because we're going through it as well as the clients. Yeah.
So I have this visual. It's Coco Gauff in the French Open. I'm seeing these feet moving. And Sandra, you were talking about constantly like feet moving and having to be able to pivot and to move. How do you balance all of that, the clinical practice, the teaching, the academic responsibilities? Because ultimately that's something that nurse faculty residents will want to have those skills, or at least the confidence to go out and learn how it best works for them. So how do you do that balance?
It can be challenging, definitely, because also if you have children, all of that comes into play as well. I think what has worked for me is actually the mentorship that I have received from my coworkers as well has been really great on especially when it comes to the academic part. I have partnered up with other people who are working on different projects, so that initially it's not just my project that I'm working on. So they mentor me into how to do these projects together, so that way it doesn't feel as overwhelming. So I would say that really to seek out the help when things feel a little bit challenging, especially at the beginning. So that was really helpful for me. But when once you get the hang of it, you're in clinical practice, you understand your clinic a little bit better, you just have things get better. But initially they are challenging. I will not lie. They're challenging initially until so you form that village, so to speak, that you have support from your mentors, and then get a system that works for you. Mm.
Yeah, thank you for bringing in like children, partners, life outside of all of this. So let's take it to like a basic day. Cindy, I'm curious, can you describe a typical day as a clinical instructor? What does that look like when you are balancing all those things? I feel, again, I'm seeing images, but it's the plates on the sticks and you're trying to spin them. What does it look like?
Well, I think on a typical clinical day for the students in community health, we meet about 8 o'clock, and we spend the first 30 to 45 minutes doing a preclinical session. And that could be just filling them in on logistics of the day, or it could be something that I've identified that, there's a little bit of a knowledge gap that they're going to need to know for later in the day. So maybe a small educational topic. And then we typically would have somebody come as a guest speaker and talk to the group about an important topic of interest related to the community health class, or we would go on an outing. And so maybe we'd go into the community to see some of the populations that are most vulnerable in our area, or some services that are in the community that are intended to provide services to some of our more vulnerable residents. And so the morning it would look a little bit different each week, but it also has some similarity. A little bit of a lunch break, and then in the afternoon, each of the students is assigned a specific preceptor. It might be a nurse, it might be a community health worker, a home visitor. And so then they go out individually with those staff members and just kind of shadow them, follow them, do what they know how to do. So it could be a little bit of education for a senior adult. It could be going to provide some support for a mother and a baby, or it could be even going out with environmental health to take a look at the restaurants in the area to make sure our community is not going to get sick from eating out. So various things in the afternoon, then gather them back together at the end of the day for the last hour to let them talk about their experiences, tell us what went well, tell us what maybe could have gone a little bit better, either programmatically or just internally for themselves. And then, trying to hear from them some of the little nuggets that they learned that day. What were their light bulb moments? What were the times when they said, I am progressing in the things that I'm supposed to be learning in this course? And then we all go home, and I'm generally tired at the end of that day. And I think they are too.
I'm tired just counting all the things that you're doing in a day and all those exciting different, environments you can put in. Sharice, I want to bring you back in because obviously we were talking about that piece of that. I'm going to bring back your sixth grade teacher, right? That they believed in you and kept telling you could do that. That mentorship piece, right? While you may not have received it in formal nursing, I have to imagine you've had mentors throughout your career. What did those mentors mean? And then how does that translate now with you when you are working with students? And how important do you think that mentorship piece is?
I think the mentorship is really key. As part of my assistant program director role in MEPN, I actually do a lot of clinical instructor mentorship and training. So I'm highly involved in a lot of the clinical instructors that we hire. Um, Honestly, when I first started out as a clinical instructor, I didn't have any mentorship at all. I kind of was just thrown into the ball game and had to figure out how to run a clinical group in the hospital setting, which is quite different from Cindy's community health clinicals. And so I did have a friend who I worked with closely, and we essentially split the group because we had to do two back-to-back 12-hour shifts with the students. So being a three shifts a week nurse and then having an additional shift was kind of rough. So we ended up splitting it. So in some way, I guess he was a mentor since he did start teaching before I did. But it wasn't completely a formal mentorship. It was more bouncing off ideas off the colleague that I had. But I really do feel like having mentorship in a clinical instructor role is really key because of the transition from being a clinical nurse to becoming an educator. There is distinct differences and boundaries that have to be set.
Okay, so all of you are teachers now. You are all educators, whether it's in that clinical instructor space or the academic space, as as we want our nurse faculty residents to do. So I'm going to throw it out to all of you. What would you say to someone if they're unsure if they're ready to teach? I mean, Sharice, it felt like you were like trial by fire. I mean, you were kind of thrown into it. But if someone's unsure, what would you all say to them? And anybody can jump in.
They go in and dabble. Reach out to a faculty member and see if you can take on shadowing one class, and then if you can take on one part of a lecture or one of the topics that you might feel comfortable or interested in. I think that was nice to ease in. I was invited to do a talk on mental health in the primary care setting, and that way you're not taking on a whole class, but you just get a chance to work and interact with students again. So I think that's just jump in and
Yeah.
do a little bit.
Yeah, I agree with
And
what
if you're
Vandy mentioned too. I've had some clinical instructors are interested in maybe doing faculty in the future. So I have reached out to them when they're teaching with me. I'm like, hey, are you interested in lecturing on a list of topics? Like I'll send them a list of topics and they can choose. And I'll give you the objectives, I'll give you the slides I've done, but you make it your own, right? Just to get that experience because developing curriculum is different from actually presenting curriculum.
And I think if you're talking about somebody who is still in clinical practice, the first step might just be to say, I want to be a preceptor for the students who are doing their clinical rotations, see how that goes. Look at look at it as an opportunity to both have input into the students as well as to develop some of your skills and see if you want to take that next step. But precepting, there's always a need for preceptors, and especially preceptors who are dedicated to it and want to learn more about how to be better preceptors. So that's a good first step for somebody who's continuing to work in clinical practice.
And I think another non-intimidating opportunity as well could be volunteering in simulations, because you might not have to do a full-on presentation, which sometimes can be daunting if you haven't done it yet. So at least simulations sort of not as intense. So that might be a way to assess whether that's something we'd be interested in long term.
Something that always excites me, and I know I talk to a lot of like preceptors, is like you are the educator, but you're also learning from your students. It's always a two-way street. So I'm curious to all of you, how has teaching changed or even enriched your own clinical practice?
I can tell you that I had a lot of bad practice because as a nurse, you end up learning the shortcuts. And so going back to understanding like the textbook way, right? Because we need to educate our students to understand there's a reason why you have to do it this way and why you have to do it based on science and data. But as nurses, we have that background, so it's just it humbles me that I realized, wow, I was taking a lot of shortcuts that were actually not great. So reteaching myself was also something I learned and is impactful to be as an educator, right? To understand that, you may think you know, but you may not. So you need to go back to the science.
Thank you for sharing that humility, right? Because we don't know what we don't know. And I think that, self-reflection and self-examination is a great quality to be an educator. Anybody else on how it's enriched your clinical practice?
I won't say it was the reason to go into teaching, but it was definitely a nice perk to be able to continue to be connected to the university, was getting access to UpToDate for free and some of these other resources and tools that you're able to look at with the students too, because it definitely let me stay up to date with the conversations and the topics of new shifts and trends, because I can definitely see if I just stayed in clinical practice only, I might get more into my own ways and kind of develop into a dinosaur as I build my habits. But having students keeps it fresh, and I think seeing their energy level with just like learning the simplest things or to us that are simple is a nice reminder too, that like, oh, okay, this is really important and big and impactful, and it's nice. I know I saw Sandra nodding, so I'll pass it to you,
Well,
Sandra.
and first of all, before we get to Sandra, you as a dinosaur, Vandy, no, I cannot see that. Sandra, go add what you wanted to.
Yeah, agree with both of you, Vandy and Sharice, in that, one, the resources, two, it forces you to be up to date on the standards of care, but also just having all these other educators around you who are doing different kinds of research, different kinds of work and projects is also pretty inspiring, that you cannot just sit still. You almost forced to continue growing in your own education, or to go for whatever you're passionate about, because everybody else around you is doing that. So that also is inspiring to me.
So we've got a couple of questions that have come in, but I want to make sure we've got about 15 minutes left, and this has been such a robust conversation, but I want to make sure our questions have come in that get addressed from our participants today. So a lot of folks want to see, after you've undergone, like become a clinical instructor or become nurse faculty, where do you see your career going in the next 3 to 5 years? And anybody can take this one.
That's always a hard question, I think, for people. I can tell you when I first started, I started off as a clinical instructor while working as a clinical nurse at the same time, and went into a faculty role 2022 or 2023, one of them, I can't remember. But at that time, I didn't really have goals. I was just trying to survive because there's a lot of things to learn as a faculty. What's interesting is that I think for me, I would envision myself maybe doing a little bit more research and more training when it comes to CI mentorship. That seems to be a passion that I have personally. Um, Position wise, I think I'm in a good position right now, being assistant program director, but not being director right away because I think that's a little intimidating. But personally, I just have a strong passion for clinical education. And so I just don't completely know what that will lead to since it's such an open door in that realm.
Anybody else forward thinking to 3 to 5 years, or are you just trying to get through today? Well, let me put it this way. Has being a clinical instructor or nurse faculty, has it opened up new opportunities that you hadn't thought of before? That you're like, huh, I never even thought about that, but this new role has made it a possibility for a next step.
I think being a clinical instructor helped me be prepared, at least partially, to do what I'm doing with the retained team and coordinating the activities and instruction for the clinical instructor interns. So I think that being one helped me understand where they might need some support, some assistance, some knowledge. And so bringing that back into my role as their coordinator, basically, has helped me a lot.
Yeah.
Sandra, yeah.
I think one opportunity that's opened up for me as a nurse faculty is I've always been passionate about global health, and I've actually had opportunities to do some work in Kenya, collaborate with the University of Nairobi, with some of the nurse faculty as well. So we've actually made 2 trips to Kenya. The last trip we took students with us, and we're hoping to grow this global health education piece at the University of at UC Davis. So that's I wouldn't have imagined that
Well, I'm
my
glad
path
you
would
brought
look
that
like
up.
that.
I'm so glad you brought it up because I'm seeing these pictures of you smiling in this wonderful area of Kenya and working with the Heart Initiative with these women and children who so desperately need it. So that is giving a future to a population that at one time may have not thought they had those opportunities. As a group, and I want everybody to answer this one, and I don't care who goes first, but maybe I'll just pick on you. But how do you feel about, as a teacher, as an educator, whether it's in the clinical realm, whether it's in the academic realm, what impact do you believe you really are having on the future of nursing education and as a result, the future of care that people receive? And I'll go to Vandy first.
Yes, I might tie into that last question, something for this group that might be considering becoming a faculty or involved with the school is what surprised me is being involved in committees. And when you're talking about impact, one is the admissions committee, where we actually have the impact of selecting which students move forward with participating in the nursing programs. And I think we all can recognize that it takes a lot of skills and it's a lot of um, like physically and mentally being prepared for understanding what this role would be. And I think that's a huge piece, but we're also invited in terms of um, working with the team in developing the curriculum throughout. So I think that's a major impact on the education of what we want to highlight. And I think one of the plug that I'll put in is that with our program, we have a really strong interest in trauma-informed practice and client-centered care. And I think that's like a UC Davis and UC whole impact there that I think living in the Bay Area, but also being a part of the UC system, I'm glad that they're aligned with those values too, that we can embed that in.
Cindy, where do you see your impact?
Well, because I've been in public health and then have been a clinical instructor in the community health course, my focus is certainly that. But the Future of Nursing 2020 to 2030, the report that came out from the Institute of Medicine several years back, it really does focus on preparing nurses to work in community-based nursing, to understand those principles of public health in more depth than had previously been part of nursing education and nursing practice. And so I fully realize that the students in front of me when I'm a clinical instructor in that course are not, they're not going to 100% go into community health for sure. But what I want them to understand is some of the principles that guide community health nursing that they can then take to them in whatever practice setting they find themselves. So, being knowledgeable about the resources in a community that they can refer people to, using social determinants of health, not in a perfunctory checkbox way as a hospital nurse who's discharging a patient, but as somebody who's really trying to figure out what are this person's social needs that are going to keep them from healing and returning to health, and how can I connect them with resources that are going to really do that for them. So just trying to embed that, some of those big broad principles into the student nurses education, so that when they're done, whatever practice setting they're in, some of those things that we're wanting to shift nursing towards are ingrained into their persona as a nurse.
And that's at the core of nursing, right? We see people beyond the incident or the interaction. It is the person and how they interact in their world. Cherise, how do you think you're molding future generations to grasp that? That is not just the clinical interaction. It is, how is this person going to achieve the things they want to achieve in life outside of the clinical space?
I would say that not just me, but our team at the MEPIN program is we really emphasize critical thinking and clinical judgment, as well as reflecting and having humility, because it is a huge aspect as being a professional nurse. And so through our continuous emphasis on critical thinking, clinical judgment, it allows them to think about the aspects that Cindy talks about, the resources. How do we prevent this patient from coming back? How do we provide that education so that they understand what their chronic disease really means and the interventions needed and why they have to take this medication, right? Because gone are the days where the nurse just cleans up the patient and passes the medication. That's all they do. So a lot of what we are doing within our program, it's emphasizing that you have to see the patient as more of a holistic being rather than just focusing on taking care of them while they're in the hospital. So what happens after? And I think my experience in transplant, since I do see them coming back often because of their transplant issues or whatever else that may happen or lack of understanding, has allowed me to really understand and emphasize to the students how important it is to really think about what's going on with your patient beyond just the clinical setting, but especially when they go home. Like, what determines a patient being able to go home, right? Critical thinking is really key, and clinical judgment is super important in healthcare.
And so I have to bring it back to you, Sandra. You brought this idea of impact up. You were talking global impact, right? But let's go back. It can be local, community, state, nation. How do you feel like as a teacher, as an educator, you're really bringing forth those ideals to really have an impact on future generations?
I think that building on all of that and what Cherise and Cindy have been talking about, I think it's important that we diversify the standard patient that we teach on, because especially when you look at Sacramento itself, that the immigrant population here and people come with different stories, that what we present to the students, the cases and all of that, it has to mirror that. It has, when I'm talking about skin conditions, it has to bring in the diversity of the patient population that we're going to see, so that it's easier to do that critical thinking and all of that when we have when we're looking at patients, and we've seen different examples of how patients can come to us. So with curriculum building, we have to keep in mind that we're diversifying the cases that we're bringing to our students. So So we train on critical thinking from that aspect, and not just the status quo has to change, I suppose. That's what I'm trying to say. Mhm.
Boom, that's a mic drop moment. I'm going to agree. The status quo has to change, and that's what these two programs within Retain are hoping. I said off the top, I'm an English major, but you all, if I could do science, you've inspired me, and hopefully you've inspired some of our participants today to say, you know what? Maybe becoming a clinical instructor, maybe becoming a faculty resident is for me. So let's go to next steps. If you are interested in either of the Retain programs, there's a couple of things that you need to start doing. Here are the steps to apply. Well, the full process is really, again, detailed on our webpage. Let's give you kind of a summary of some additional items that you will need to submit along with the online application. A cover letter, a CV or resume, and contact information for 2 references. Applications are due on July 27th, which is just a little over a month away. But if you're like all of us, time flies. It flies. It'll come right up on you. So start doing this now. Classes or your program does not start until September the 16th. And this is a rolling admissions process. So if you are interested and you want to apply, you don't have to wait a long time to find out if September 16th is going to change your life and start you on a new trajectory. We do have rolling processes. Of course, you can go to the webpage, you can scan the QR code to apply, but just look at that in red on the screen. Applications due on July the 27th. Of course, lots of questions you may have, so lots of ways to connect with us. Visit the website, email us, or sign up to receive email updates. So we really hope that this has inspired you. This has given you the information you need to make a real educated lifetime decision if this is where you see yourself going, or if this is a desire you've seen in order to grow in your career and in your personal development. After this webinar, I will ask a quick favor. We want to make sure that these webinars are valuable and giving you the information you need. So if you could take the brief survey that will pop up once we're done, we would appreciate that. Of course, we do have the follow-up email coming and the recording. That will be a chance also to fill out the survey if you would like to. And we just hope that you'll take a chance on yourself, because the future of nursing needs you. From everybody here at the Betty Irene Moore School of Nursing at UC Davis, I'm Rebecca Badeau. Thanks for joining us, and be well.